Welcome to this session of the Open Season Exchange. My guest is Ed DeHarde. He's the Deputy Associate Director for Federal Employees Insurance Operations at the Office of Personnel Management. Ed, thank you so much for being here.
Thank you very much.
So today we're talking about open season for the Federal Employees Health Benefits Program. The Office of Personnel Management just released the latest health premium rates for FEHB participants, and for 2023, health premiums will increase at a higher rate than what we've seen in over a decade. But there are also several changes to the existing FEHB options, a couple new plans available, and other expanded coverages as well. So there's a lot going on, but let's start here. We know that the vast majority, over 95% of FEHB participants, typically don't make any changes to their health plan choices during open season. But this year, we're also seeing that high health premium rate increase. Enrollees payments are actually going to go up by an average of 8.7%. So Ed, how do you think that could affect the number of people who participate in open season this year?
Every year, we announce a premium increase, and every year that's tied to forces in the market that affect healthcare overall. Every year that announced premium increase is higher than what the premium increase actually ends up when people do change. When people don't change, they're leaving money on the table. So the open season is a huge opportunity to shop. It's a huge opportunity for people to make better choices that provide better value to them. Every FEHB plan provides comprehensive quality coverage. And my foremost message is shop, shop, shop. Get out there and look at the benefits. And we hope each year that more and more people will do that. And we do a lot each year to continuously make improvements to the information that we can show to people that want to get out there and shop and make choices.
So let's talk a little bit about why the average premium rate is increasing so much for 2023. It's as I said, more than it has been in the last couple of years. What are some of the biggest reasons behind that?
As I said just now, it's a market-based program and it's centered on choice and competition, and we need people shopping and choosing. The major cost drivers of our program align with those out in the commercial market: pharmacy spending, including expensive specialty drugs, cost of treating chronic illnesses, advances in medical technology, et cetera. And what we're seeing specifically in our plans is higher than expected utilization in outpatient services and facilities, increases in utilization of professional services, and increased utilization and unit cost in specialty drugs. And these are things that aren't unique to the FEHB program market. They're out there in the entire commercial industry.
So can you talk a little bit more about the comparison between the commercial industry and FEHB? Have you seen similar increases to private sector rates for 2023?
Yes, we have. So our average increase is 7.2%. According to the Business Group on Health, the average is 8.2%, and Kaiser Family Foundation is reporting 10%. So we're in line with the commercial market, and we may even be slightly under it, which is pretty common for the FEHB, and that's one of the geniuses of this competitive market. Not everybody has this level of choice. The FEHB program members have this amount of choice, so virtually every member can shop each year for a better value. And the more that do, the more our premium can come downward in the aggregate.
So I guess more on the practical side, how and where exactly do you make changes to your FEHB enrollment options, and what should participants know about that process?
It's different. Now, this is something we're working on, and we're trying to make it less different. We're trying to make it, and this is for future, where you can go to one shop and make your enrollment choices. But currently for the FEHB program, if you're an active employee, your enrollment is controlled through your agency. So you would check with your agency benefit officer or your agency personnel office, but most employees know, and there are electronic interfaces: Employee Express, MyPay, Postal Ease, DoD has their own interface. So for active employees, they would explore these interfaces. For agencies that don't have an interface, they would do what's called a 2809 form and submit it to their personnel office. For annuitants, they enroll through my agency, OPM, Retirement Services. They do they act as the annuitant personnel office for federal annuitants. And there's an open season enrollment number that we put out on our website. There's also an electronic interface. Now, this is for the Federal Employees Health Benefits Program. This is the federal benefits open season. It's FEHB, it's FEDVIP, dental and vision insurance, and it's to make an election in the FSA Feds program if you want to participate and have a healthcare and dependent care FSA. So for FEDVIP, you would go to benefeds.com, BENEFEDS. And for FSA Feds, you would go to FSAFeds.com, FSAFEDS.com.
So several different websites to kind of track everything, but you mentioned earlier on that you have this plan to kind of make it what you called less different. Can you talk a little bit about some of those future plans and maybe if you have any sense of timeline for when that might be changing?
We will have something up for some in the 2024 open season for 2025 would be our plan. So it won't be for 2022 for 23 and likely not for next year's open season, but the following, we hope to have something in that regard. And I may have omitted just now, I told you how to enroll, but what to do to consider plan choices, you can go to opm.gov, and we are kind of one stop here. You can go opm.gov, click for healthcare and insurance, and there's a place there to compare plans, and there's a place there that provides copious information on every available plan in every area. So each individual considering enrolling would go to the plan comparison tool, type in their zip code, it'll show the array of plans, FEHB plans that are available to them. There's a similar tool for FEDVIP on the Benefeds website. Once it shows all that's available to you, you can select checkboxes of the plans that you want to compare more rigorously. And then there are links to the plans that you want to compare more rigorously to all of the comprehensive information related to the plan provider directory, and information on how to reach that plan so you can discuss things with them directly. Going a little bit further on that, what I would recommend when people do that exercise, and then they get down, so I'm in this plan and I want to consider these 2 or 3 other plans, talk to your doctor, talk to your specialist, look in the plan material first. It'll tell you whether your doctor's in, but then talk to your doctor, talk to their office staff. And there is likely a scenario where you can receive the same healthcare coverage or the healthcare coverage that you need for less money.
So there's a lot of information out there. Can you give me a couple examples of what types of questions participants should be asking themselves and the carriers when thinking about making changes to their healthcare choices during open season?
Well, I think I covered some of that, but what you want to do is you want to say, what healthcare do I think I'm going to need? Now this is insurance. It's not pre-funding and no need, but people know what they're generally going to need next year. Do I just go in for an annual physical? Do I have a chronic health condition for which I see specialists? What have been my services for the past several years? What have my doctors told me about what I'm going to need next year? Am I going to need to get a colonoscopy? Am I going to need this and that? And once you think about that, you can look to the specific coverages in those brochures. Still insurance, so you don't really know. So you want to ask yourself, what is my risk tolerance? So there's always probably, unless you're in the cheapest plan, there's always maybe a cheaper plan, but you want to look at the cost sharing, the deductibles, the co-insurance, the catastrophic protection out-of-pocket maxes, and figure out what you think your cost is going to be versus that insurance coverage. And I know that's complicated, but that's not onerous. That's a benefit that we have as federal employees, annuitants, and other covered individuals.
So on the other side of the coin, what happens if a federal employee in the FEHB does nothing during open season? You mentioned earlier on that that could leave savings on the table that are available to participants. Can you talk a little bit in more detail how much savings and what would they be missing out on?
It all depends. You can maybe, if you're in the most expensive plan, and you could go to the least expensive plan, you could maybe save up to 50% on your premiums, depending on what local area you're in. But if you're a utilizer of health services, you're going to pay cost sharing, you're going to pay deductibles, as I just said. So it all depends on the specific individual. And it gets more nuanced than that, because if everybody went into the cheapest plan, it would not long be the cheapest plan, maybe for that year. But the premiums are established based on the utilization and the projected utilization of the parties. You ask, what happens if they do nothing? In FEHB, if you don't make an election, you stay in the plan that you're in. So I had a colleague in our in my office, not in my healthcare area, but in OPM years ago, and he called me and said, "When did my premium go up 50%?" And I looked, and I said, 5 years ago. 5 years ago, it went up 50%. It didn't go up 50% just now, but they had never looked. You cannot look. If you're in, you'll stay in. You'll stay in the same plan, but it greatly behooves everyone to look, to shop, and to think about making an election. Now, that's for FEHB. Same applies for FEDVIP. If you do nothing in FEDVIP, you'll remain in the plan you're in. Now, if you're participating in FSA Feds, and this is for active employees, you have to make an election each year. That's not an OPM rule, it's an IRS rule. If you don't make an election, you are not in. So when we talk about mistakes people make during open season, they think that their election continues in the following year. For FSA Feds, it does not. You must go into FSA Feds and make a new election each calendar year.
So let's talk a little bit more about the FSA Feds program for a minute. Can you explain how exactly that works and what type of expenses are eligible to be covered in the program?
Okay, there are two elements to the FSA Feds program. There's a healthcare FSA and there is a dependent care FSA. I'll talk about the healthcare FSA first. It actually represents health insurance to the insured. So you have to make an allotment from salary. For active employees, there's 26 pay periods. So if you make an allotment of $2,000 annually, that will be divided into 26 pay periods. You can accelerate it if you like, but whatever that math comes out to, I should have made it more simple. Say you allot $2,600, you allot $100 a pay period. The moment you make your first allotment, you're insured, and you can use the full $2,600. Now, if you don't use the money, you paid that premium and it's gone. Okay, so you don't want to over put money in. You want to put in what you think you're going to use, and that can be used to offset your copays, your cost sharing in your health plan. And what's allowed is any IRS Section 213D medical expense. But there's many things that are covered there. And there's even some over-the-counter medications. There's a comprehensive list on the FSA Feds website. So that's something that people definitely want to explore, and something we've set up over the years for most of the health plans, most of the large health plans, and coverage of most all of the FEHB program members is if you're in an FEHB plan and you're in a healthcare flexible spending account, there's something called paperless reimbursement. So when you go to the doctor, you pay a $20 copay, that automatically gets transmitted to your healthcare FSA, and the healthcare FSA deposits $20 in your bank account and reimburses you. So that's a pretty smooth feature that we have there. Now, the dependent care FSA is a little bit different. It's not insurance at all. It's pre-funding your dependent care needs. And by the way, the benefit of this is both of these, it's pre-tax. So it's a direct reduction of your above the line income when you file your taxes at the end of the year. So if you're in a 30, I'll make 33% because it's easy. If your tax rate is 33% and you put $100 in your FSA, you just saved $33. So it's like money in your pocket. The dependent care FSA, you can only use what's in the account. So you can get reimbursed if you've spent the money on dependent care. As you spend it, you can get reimbursed up to what's in your account throughout the year. So if you have a dependent care need, you're paying dependent care, and you know what that need is and what it's going to be, you should definitely be in the dependent care FSA.
So there is all of that that's available to participants. Can you tell me who exactly are flexible spending accounts available to, and also how many federal employees or annuitants actually take advantage of the program?
It's available to active employees. It's a salary reduction agreement. It's called. That sounds funny, salary reduction, but it's not really reducing your income at all. It's reducing the above the line amount on your taxes. And as I said, it's an IRS program. You have to be an active employee receiving payroll in order to get the program. I don't have the figure here with me, but I think it's lower than 20% of those who might be able to benefit from it. I think it's slightly underutilized relative to what it could be. And as I said, everyone should look at it. Everyone who especially if you have known dependent care needs. But both sides, and I forgot to mention one thing. In general, a healthcare FSA may not be available to those who have, for instance, a high deductible health plan with an HSA and certain other coverages. But we also have a limited expense FSA to try to make something available to virtually everyone who receives salary and could benefit from the program. So even if you go to look and you find that you're excluded through one of these things, look at the limited expense FSA too, and there's probably something there for you.
So let's broaden out a little bit to talk about some of the expanded coverages overall for 2023. What new coverages are available or benefits to FEHB participants? I know one is telehealth. Are there a couple others that are expanding next year? We
obviously have continued to add whatever countermeasures become available for the COVID pandemic. So those things are available and being covered. We've been trying to address inequalities in maternal health and expanding coverages and services in support of prenatal and postpartum care. And this is a very important thing. This is a nationwide issue, again, that affects everyone, and we're not immune to it. And we've worked with the carriers to try to improve coverage in that area. We're incentivizing or asking, and we're encouraging the carriers to offer more in terms of assisted reproductive technology. And we've received some positive action from the carriers in that regard, and we're continuing to emphasize that going forward, I believe. We've improved access to gender-affirming care and services for transgender and gender-diverse individuals. And we've made the language of all of our plan materials such that it promotes gender equity. We've also asked the carriers, for a while, we've had preventive services that are USPSTF recommended A or B are covered at no cost under the FEHB program. And we think that preventive services are extremely important in producing better health outcomes downstream. And we've asked the carriers to cover any preventive service that the USPSTF upgrades to A and B, even within a plan year, to the greatest extent practicable as quickly as possible. So in many instances where you may have in the past found out that there was a improvement in care relative to a preventive services, now you will get that sooner. And that's something we think is very important. You mentioned telehealth. Telehealth is not new. We've been asking carriers to focus on that for several years. the COVID pandemic had one positive outcome in that it promoted telehealth largely because it had to happen. People couldn't go out, couldn't go in, social distancing. So kind of organically, telehealth really expanded in its usage. And much of that is positive. And we are continuing to ask the carriers to focus on that. And as we're returning to work, we're talking about hybrid work now and taking some of the improvements that we've learned in terms of remote work versus in the office. And for medical care, a similar dynamics occurring where in many instances, telehealth can be assistive in potentially producing better health outcomes. So we're going to continue, I think, to emphasize that.
And all of those things, with telehealth, gender affirming care, all the stuff that you are expanding this year, are these things that you see continuing to expand for the long term for FEHB?
Well, we formulate our negotiation and policy objectives annually, and we release an annual call letter. But I believe, yes, I think we will continue to incentivize these things.
Of course, everything with FEHB and open season really ramps up in the fall timeframe. That's when open season is. Is that, but I guess during the rest of the year, how do you work with different carriers to kind of make plans, and what does that timeline look like for the rest of the year?
Right. Our contracts are we call them evergreen. And so we contract with our carriers. The contract year ends, but the contract doesn't end. Our contract officers work with the carriers on a daily basis. Our health insurance specialists work with them on a daily basis. And things arise that are in essence negotiation, if you will, during the year. We released the call letter that I mentioned a while back. That has our policy objectives for the upcoming negotiation. And then the carrier proposals are due to OPM on May 31st of each year. The contracting officers, contract specialists work with the plans then to establish what benefits will be offered. The price proposals come in with the benefit proposals. And our contract officers work hand in glove with our actuaries. So as we're working on benefits, we're looking at rates. We establish the benefits first, then we establish the rates, and our actuaries receive all of the information from the carrier to justify the rate that they've proposed. It's all thoroughly reviewed, and the law requires that the FEHB premiums be a reasonable reflection of the cost of benefits provided, and that's what we do each year. There's not a lot of slack in this premium. You're paying for the benefits provided, a very small amount for administrative costs, which is limited, and a profit that is limited also to, in general, less than 1% of projected claims and admin. And that then is established prior to the material that appears on the website that creates the open season, that then allows everyone to make a choice.
And let's talk a little bit more about some of the plans that are available for 2023. Are there any new insurance carriers for next year? Any going away?
There is a new carrier in Indiana University Health Plan. There's several new plan options, a couple in Kentucky, one in Ohio, and one in California. And I don't have the list. We do what's called a BAL, a benefit administration letter, and we release an open season BAL out to the agencies, but it's publicly available. And it shows what plans are leaving and what plans are added. And I think we are losing a few options this year, but in general, they're very small options that didn't succeed in the market and had very low enrollments. So there's not much disruption from that.
Well, speaking, I guess, on some of the more popular options, some of the Blue Cross and Blue Shield's basic and standard options are actually going to be increasing next year, even more than the average for FEHB. Do you have any recommendations for participants in those plans?
It's the same recommendation I've given. Get out there on our website, look at the plan options. There likely is a plan for you that can give you a lower cost and potentially better value than. The cost is a reflection of the benefits provided. So the costs are going up, but that's not necessarily a bad deal. It's still very good value. So you may not have made a bad choice if you elect to stay with your current plan, but you want to look and you want to proactively make a choice. If you don't do anything and you simply remain in the plan you're making a choice.
So what about participants in FEHB for their vision and dental plans? What are some of the changes that we're going to see for 2023 with those?
We've made some good changes in these plans, very good changes, and we've improved access to pediatric dentistry. We've eliminated orthodontic waiting periods, and we've held down, and I don't have it right before me, but we've been able to hold down the dental premium increase to an extremely low amount. And for vision, I think I said increase. The increase is very small. For vision, there's actually a decrease in premiums on average. And again, these are averages, so you want to look at your plan and see how you feel about the coverage you're getting and speak to your dentist.
And we've also seen some changes for incentives in Medicare Part B and those who are Medicare beneficiaries. What would you recommend to annuitants who are enrolled in Medicare as well?
We try to make it such that you can get value from all the money that you've paid in over your career into the Medicare Trust Fund. If you're a duly eligible FEHB program annuitant who is eligible for Medicare, it may be in your best interest to enroll in Medicare and then choose a plan that coordinates well with Medicare. We have plans that offer waivers of cost sharing and other incentives so that it makes it a good value for you to be duly enrolled. We also have plans that have mechanisms to help offset the cost of your Medicare premium, which is an exceptional deal for these individuals. There also is the risk bargain. How much tolerance of risk do you have? For instance, if you want to be in an FEHB program HMO, you can enroll in traditional Medicare. You can see any provider that participates in Medicare. There also are other options. You can suspend your FEHB program coverage and you can enroll strictly in a Medicare Advantage plan. And it's an exception for, in general, if you're an annuitant and you leave FEHB, you cannot come back in. But if you suspend to enroll in Medicare Advantage, you can come back in if you choose to later. You unsuspend your coverage. But there also are options where you can be in an FEHB program plan and in a Medicare Advantage plan that's sponsored by an affiliate of that FEHB program plan, and they'll provide seamless coordination to you, which may be the best value for many individuals. So again, these are complicated choices, and we're trying to put information out on our website to make it where you can go one stop and see what's best for you. And we do have some information out there when you do your plan compare that it'll show what value you may get out of those Medicare arrangements.
Well, Ed, we've covered a lot of ground here, but I just wanted to ask one final question. What is the one thing that you would want FEHB participants to take away from our discussion today?
Get out there and look at your current plan. Look at the changes in every plan on the front page. It says changes on page such and such. Go to that page. Look at the changes, especially if the plan is changing in a way that might not suit you. You want to look, but whether it's changing in that way or not, go out to the plan comparison tool and look at a couple of other plans, and then think about what might happen if you switch to those plans, how that might affect your cost or your coverage. And then if it looks like you might be able to make a better arrangement, talk to your providers. But what you want to do is shop. You want to shop early in the open season, and you want to really think about this. You don't want to, we try to make it so that if it just happens to you, if you're in and you do nothing, you still have a good deal. It's still a good deal to be in the FEHB program. You're getting exemplary world-class health coverage at a fair deal. But don't just let it happen to you. Get out on their website, shop, and shop early. Too many people wait until the very, very, very last day of open season to try to make their choice. You don't want to do that. You want to get in there early. You want to feel good about your choice, and you can get in an arrangement where you can save money. One of the things I haven't talked about a lot is these HDHP plans with HSAs. For an active employee who is eligible for these plans, you can enroll in the plan, and the plan puts money in an account for you to spend for your healthcare costs. And that's your money. And if you don't spend it, it continues to accrue and it gains investment income. And you can use it at any point in your lifetime for medical expenses. And the medical expenses that are available are the same ones that would be available under the healthcare FSA. So that's another option that maybe people haven't looked at or haven't considered.
Great. Well, a lot of great information today, and that's all the time that we have. Let me thank my guest. Ed DeHarde is the Deputy Associate Director for Federal Employees Insurance Operations at the Office of Personnel Management. I'm Drew Friedman. Now let me send you back to the studio for more on the open season exchange on Federal News Network.